Dr. Lee Funk. I'm both an acupuncture physician as well as a chiropractic physician. I'd like to tell you a little bit about myself before we get started. I was a paramedic for 10 years, ACLS certified, worked air ambulance and for fire department. And the year 1991, I became a chiropractic physician. The year 2000, I became very ill with asthma and pneumonia, and literally had pneumonia 20 times and had to retire. So I finally, ultimately, after seeing a pulmonary specialist and her telling me people die from this every day, I decided to go a different route. And I went to an acupuncture physician or doctor of oriental medicine and an MD, and he treated me with acupuncture and Chinese herbs and homeopathy. The results were amazing, from near death to near perfect health again. So anyway, I decided at that time that I was going to become an acupuncture physician and get a second doctorate, which I did, and have never regretted it. I learned so much. So what is my vision and my purpose for being with you today? Well, it's to teach you a technique in acupuncture called Korean hand energetics. And it's done solely on the hands. And you can actually even see a few magnets on my hands. I don't have glasses on, and and my vision at 67 is not the best. But when I treat myself, it's amazing. And the beauty of Korean hand energetics is you can treat yourself. You can treat your family members. You can treat anybody, anywhere, anytime. That's the beauty of it. It's a tremendous adjunct to chiropractic, to osteopathy, to if you're an MD or a physical therapist. And for pain, I like to say eradication rather than management. It is amazing, astounding, because the beauty of it is we teach our patients or lay people how to treat themselves. So in reality, they get a treatment every day, maybe twice a day. And historically, I treat myself every day. Now, do I only do Korean hand energetics? No, I use needles. And I've used lasers before, and I've used manipulation as a chiropractor. But I do a little more osteopathic manipulation, cranial sacral now. But I blend it all in together. And when you combine a multiplicity of techniques, the results can be astounding. You know, herbology and homeopathy, all of which I hope to go over with you to some extent in these 3 one-hour segments I'm going to share with you today. So let's go ahead and get started on Korean hand energetics. As I said, it is a system where we use the hands solely for the treatment. Okay. Now, one of my teachers or masters, he's an Oriental medical doctor. He only, and I want to stress, only uses North and South Pole magnets. This is a group of about 30 of them, and we just tape them in position. Now, there's other magnets called Sujok magnets, which are relatively powerful as well, and I used them for 12 years, 15 years, and I still use them in some cases. These are so powerful that sometimes they get stuck together. And so we have ways of dealing with that as well, and I'll go over all of that with you. But there are times where some patients like those weaker magnets, and with their constitutional issues, say if they're excess or deficient, you might want to use the little bit weaker magnet. Now, the tools of our trade in this case is 3M surgical tape. This is the waterproof porous tape. You can get it from Amazon. It's micropore tape, and you can use the very expensive instrument, a Callaway golf tee, or these tees that I got off Amazon. No, actually, I got off of eBay. Okay, so as I said, the treatment is done solely through the hands. The left hand primarily treats the left side of the body. From here we go. This is my drawing pen, which is great. From the midline over. Okay, so this is the anterior body. The front of the hand in the anatomical position would be anterior. So from the midline over to the ulnar side or pinky side, if you're a CA wanting to learn this, to do in the chiropractor's office you work in, or a PA or a nurse practitioner, or really anybody can do this. So and my vision is to create 1 million mini acupuncturists. I go on mission trips, and my goal is to teach the missionaries how to treat themselves. And I've been to Honduras, Haiti, and all numerous places, and so I'm going to Zoom them, as I'm doing with you today, or will do with you in the future, to be able to teach them how to treat themselves. But I also do telemedicine, and I treat patients online through Zoom or through Skype, however, or through FaceTime on an iPhone. But again, midline over to the pinky side is going to treat from the midline over. Okay. Now I have a PowerPoint, multiplicity of PowerPoints that I'm going to use as well. So again, it's midline over would be using the right hand primarily from the midline here over here. Now, this pinky is your lower extremity. The ring finger is your upper extremity. Okay, it's a microsystem, a microsystem, a homunculus, a very small representation of your whole body. I'm sure you remember the old days when we had 1/24th scale slot cars. Maybe some of you don't remember that. We used to zoom around tracks with them. Well, this hand is kind of like a 1/24th scale of the entire body. And as I said, this is the posterior body right here. Okay, this is the spine. This would be the top of the head. This would be the back of the head, midline right here would be what we call in Chinese medicine the Du meridian. Okay, right down the middle. If we come off to the side just a little bit, to the ulnar side, tiny bit, that would be the bladder meridian. Come out a little more, that's gallbladder. Okay, if you're a TCM doc or an acupuncturist. So all the meridians on the body are represented on the hand. Now, we can make this really easy. You know, Dr. Tan, who I trained with and followed him all over the country, I tortured him night and day, called him. And the joke was that when I would call him, he said, "Oh, this is Dr. Lee," click, hang up on me. So I'd go to a payphone, that dates me, and, and call him. And he said, "This is Dr. Lee," click. Actually, we were great friends. We went to lunch together and at his seminars, and what a amazing, he changed my life with his teaching. So what I've done is taken what he's done and applied it to the hands, or I should say one of my teachers did that. And I am just utilizing that type or style of teaching, blending it in to Korean hand energetics. Okay, or it's called Korean hand therapy, and some anesthesiologists out there call it Korean or just hand therapy. It's a whole different system as well. There are numerous microsystems. I teach the ear, auricular therapy, auricular medicine. I teach scalp acupuncture. I combine Dr. ZHU, and Richard Tan, and some of the other doctors to create my own system of what we call three-phase scalp acupuncture. Now, let's take it a step further now. As I said, this, and I'm kind of going over this a lot of times, I know, but I want you to lock this into your head before we get to the PowerPoints. This is the front of your body. This is the back of your body. This would be dorsal. This would be ventral, or anterior, posterior. If you're a layperson, front and back. And I'm going over this many times so you really can grasp what I'm saying. Now, this is the lower extremity here, as I said. So this would be the toes. And this first bend here at the distal interphalangeal joint would be the ankle. And as we come down to the proximal interphalangeal joint, where that bend is, that would be the knee. Isn't that amazing how we were wondrously created? And then here, we're looking at the hip, or in this case, to be more the groin. But if you have a groin pain, many times that's a hip problem. We'll just throw that in there for fun. Now, this, again, the ring finger, or fourth digit, these would be the fingers. This would be the wrist. This would be the elbow, and this would be the shoulder. Okay, and it is amazingly effective, even with frozen shoulder. Sometimes I'll put a magnet, and patient hasn't been able to raise their arm for years or months, and the arm goes up over their head. I even had a doctor that I taught, a chiropractor, called me one time, said he wasn't able to help this frozen shoulder, and he treated, and he called me and said it worked beautifully, and the arm went up, and amazing thing. So I want you to get this brief overview in your mind. Now, this is the afferent efferent nervous system. or this would be the spine. So this would affect a motor and sensory function, just like in chiropractic. It's the same thing. And it lines up beautifully, just like in chiropractic. It lines up with the love it principle as well, where sometimes we treat the neck through the low back, which would be in this area right here, and sometimes we treat the low back through this area right here. Now, it also represents um, something like an atlas orthogonal treatment as well. So, our goal here is to give you the information you need to be able to start treating people tomorrow. Now, I can send you the magnets and the tape, or you can get the magnets from Gauss Boys and just mention my name. They're so strong, I just pulled it out of my hand, literally, just to show you how powerful these magnets are. I'm holding about 15 of them right here. And let me get close here, and wow, they're powerful. And as I said, you don't have to use the really powerful ones. You can use the Sujok magnets, and they work beautifully as well. Okay, excuse me, I'm going to get a little drink. Maybe somebody will cut that out. But anyway, as I said, this is the front of the body. This is the back of the body. These are what are called the alarm points, all in here, okay? And this would be Ren 1 right here. This would be Do 1 right back here where the hand, the wrist extends, that little opening, frame and opening, or whatever you want to call it. That's going to be Do 1. This would be Do 20 up here if you're an acupuncturist, or the top of the head. Let's keep it simple. So the area where it's bending right here, where you can feel that little groove, that's the anus. And this would be the perineum, or for sexual dysfunction or urinary tract infections, this would be your area. Now, there are many other areas in systems. For those of you who are familiar with French auriculotherapy or auricular medicine with Paul Noget's technique from the 50s, 60s, we have phases, and everything shifts and changes with degeneration. We're not going to cover that today, but in some cases, we have to take it a little step further, which I started doing 13 years ago. And then talked to some of the masters. I said, oh, don't bother with that. It was just a couple of MDs that created it. But let me tell you, they were brilliant anesthesiologists, Brian Frank and Nader Solomon, that created that system of three-phase Korean hand therapy, or as they call it, hand therapy. We call it Korean hand energetics because we use these very powerful magnets. Okay. Okay. Now, again, this would be the lower extremity. This would be the upper extremity. This would be the spine. Now, in some cases, they look at this on the front of the body as being the spine as well, and it still works because the palm of the hand is very sensitive, and really gives tremendous information to us on where the pain is, because we're palpating for the most tender region. So now I'm going to stop for a second and we'll continue. I'm going to pull up a PowerPoint and I'll be back with you in a second. Okay, now we're back. Now, this is the PowerPoint that goes along with this 3 1-hour, 50-minute seminars that we're doing for you today. As I said, it's called Korean Hand Energetics. You can use needles if you want to. In some cases, I do, because I do Master Dong and Richard Tan's work, and Master Dong, I guess it's spelled, and Dr. Ju, and many of the other techniques, and Paul Noget's auriculotherapy. Also, the ear doc taught that. So I'm trying to give credit to whom credit is due. There are many amazing teachers and masters that I've spent time with, that I've gone and literally visited and spent time in their offices and learned from them. You can see I play guitar, and I have a lot of Chinese herbs, some of Steven Steitler's tinctures, and some from Evergreen and different companies. And I'm not advertising for them. And in the upper left, that's my book back there, which you can download from Amazon. Today, I'm going to teach from this PowerPoint. We're going to keep it very simple. And as I said, I'm a chiropractor and acupuncturist, and I've been through medical school and all that, and we won't waste your time with those thoughts. So let's move forward into the PowerPoint. And here's a disclaimer. Uh, Before you embark on this type of treatment, you need to talk it over with your doctor or read this. All right. Now, what is KHE? Well, Korean hand energetics is a form of acupuncture, moxibustion, that affects the entire body with therapy on the hands only. I have already said that. Now, it is an ancient acupuncture theory applied with modern scientific knowledge and technology. It was developed by Tai Wu Yu, and he uses from South Korea, North and South Pole. How do I explain it? Little pieces of metallic pieces. They look like silver and gold, but in reality, they're not. They're just dissimilar metals that have a charge, and that's what he uses. They're not as powerful, but he's a genius, and he doesn't need a lot of power. I'm not at his level. And that's one of the reasons I'm teaching as well, is because one of my masters said, Lee, why don't you just teach? He calls me Dr. Funk, but I'm Lee. And he he said, you need to teach. So that's why I'm doing this, because I want to take it to the next level. I would love to be good enough to where I didn't need to use needles. That'd be great. But I don't know if that's going to happen. It probably won't. But it did for him, and he was a big needle guy. 100% needles. So that's what we're going to talk about. As I said, developed in 1975. It uses what we call reflex zones on the hand, similar to the feet, the hands and the feet. The hands have so much dexterity, though. They take up a huge area of the brain, and they move the brain. And how does it work? How does acupuncture work? Well, from the WHO and National Institutes of Health, which I'm not sure if I fully, we won't go there. But that research that they've done states that when you place a needle, a laser, stimulate a magnet, it sends a message to the brain, number one, to release endorphins and enkephalins, bradykinin, and neurotransmitters. That's enough to fatigue you right there, to get rid of pain or calm down the pain. But that's just one aspect of it. Number two, and this is really taken from the I Ching, or ancient Chinese manuscripts, that it increases blood flow. Now, in Chinese medicine, we believe that you move the qi and that moves the blood. Well, it causes vasodilation from a Western point of view, but and then so the area gets fed, it gets nutrition. But that's just two of the items. Number three, if it's a joint malfunction, a frozen shoulder, an issue like that where it's restricted from scar tissue, or whatever the problem is, it causes the muscles around the joint or the viscera anywhere. If you have an irritable bowel or something like that, it causes it causes the muscles or the musculature to come out of spasm. In the case of a joint problem, like a a humeral problem, the or a femoral problem where the femoral head goes into the acetabulum, muscles come out of spasm, so then the joint can shift back into place and articulate better. Now, I really believe there's a lot more to it than just the muscles coming out of spasm. I believe there's much more to it. The movement of the chi moves the blood. It's just a combination of things that promote healing and amazing results. And usually I get a result in 2 to 5 seconds, and the patients know it. That's the beauty of it. They definitely know it. And that's with acupuncture too, using Richard Tan's work, Master Dong, and then utilizing moxibustion as well as cupping. It all works, or even bloodletting techniques. But my latest teacher master, he doesn't, I don't think he does any of that anymore. And he's an OMD, trained in China and the US, and he only uses this with tinctures and herbs and homeopathy. And I'm going to hopefully share a little homeopathy with you as well in this 3 hours, 1 hour or 50-minute segments. Okay, now I have an ion beam stimulator, but I don't use it, but it is cool. It works, and it has a positive and negative polarity, and that's where the power comes in. Some units on the ear are unipolar. They work, but they're not as powerful. When you find the correct polarity, which there's a machine called a StimFlex 400 or 400A. I just happen to have one of the 150s. Only 57 were made. And that's done on the ear. It measures negative and positive polarity on the ear. And I had the worst unrelenting back pain for years. And I foolishly had a tiny little procedure on my back about 15 years ago. And my legs went numb after that, and they were cold for a year and still had the pain. And finally, I flew out to Tulsa and was treated in the former ORU building on the ear, and the pain was gone in 2 to 3 minutes and didn't come back for 10 years until I did something very foolish. And the pain is all gone now again. I was in medical school, injured my back horribly. Couldn't sit, couldn't stand, couldn't lay down. It was really bad. And I had injections, I hate to admit it. And then finally, I went back into practice and treated myself. First, I saw a master in Jacksonville, and she miraculously helped me. It was amazing. So, but today we're going to stay focused on this. I teach so many different techniques, I have to control myself. But don't forget the moxibustion. And I'll try to find the time to go over some of that with you as well. I'm looking for one of my sticks, a very thin little stick, and you do it all on the hand. Now, sometimes I still go to my body points. If I have a little phlegm or something, a stomach 40 or something like that. But it's all represented on the hand, and you don't really need to do any of that. So let's continue with this. Okay. Now, what does it do? It treats musculoskeletal tendonitis, contusions, upper respiratory infections, nasal sinus, sore throat, ear pain, especially. Now, I do bloodletting techniques for sore throats and things of that nature. But I really believe if I was good enough at this, and I'm not the best in the world yet. I'm working on it. But my main vision is to create 1 million people using this because it is so amazing. Tremendous for allergies. Nambutipod's allergy elimination technique, you can apply it to magnets on the hand, or you can rub the points, or you can needle the points, or laser the points, or vibrate over those points. It all works. Great for digestive problems because you can treat all the front moo points. You can treat it in combination with needles on the body. You can even, in some cases, use the magnets on the body too, and that's very powerful. Now, tremendous for women's health problems, and I have a list of about 100, maybe 200 protocols that I'll try to share with you during this point in time. And as I said, you can download my book. Look for Dr. Lee Funk, Korean Hand Therapy in this case, and you can use my book, and I'll be going into that to some extent as well. Now, also, it's great for metabolic issues. There are techniques blended within here for the HPO system, hypothalamus, pituitary, and organ, and that feedback loop or negative feedback loop. You can use that as well because you can tonify, build, and strengthen if you have something that's very deficient, or you can sedate and calm down if they're excess, as in hypertension or liver yon rising or something of that nature. But chronic fatigue and fibromyalgia are things that we can treat with this as well. But of course, we're blending it with Chinese herbology, using tinctures, using granules, which I do a lot of. I'm moving more into tinctures now because they last forever. And because there's a little bit of grain alcohol in them to preserve them. But the beauty of this is, and the reason I'm teaching today, is that you can treat yourself at home, treat your family members, treat your neighbors, and it's safe and effect clinically, as Dr. Tan did say, clinically effectsy. And I'm not making fun of him. I love the guy and the whole family. They're wonderful. But anyhow, it's clinically effective, and you can use it with any other technique. Now, you do have to be a little cautious not to do too many points. As in homeopathy, as in herbology, we just want to use enough. We don't want to do too much. We want to use just enough, and it's more powerful if we're more accurate. Okay? Let's move forward. As I mentioned, needles are not necessary, and there's no disrobing by the patient. That's the beauty of that. The other day I was on a mission trip, and here comes another war story, in the Dominican Republic, way up in the mountains somewhere. I'm not even sure where I was. We were at a luxury hotel with all the food and drinks and everything, and the missionaries would come down from the mountains and pick us up and drive us an hour and a half into the mountains. And And I have a little joke. I only drink if it's free. Well, the drinks were free, and I mistakenly took part of that. I did that. Which I regretted later. I probably won't do that again. I repented. But anyway, they took us up into the churches, and we prayed for the people and in the churches. And then after the service, we actually treated the people inside the churches. It was amazing, most amazing week of my life. And of course, I go on mission trips to the Bahamas, which I was just there in November, and hope to get back there very soon. But my vision is, and a nurse from one of the mission ships is coming back, and I'm going to train her in this, and then we'll Zoom and we'll just treat patients on the internet. It's a beautiful thing. Now, I want you to remember that I do still treat patients. I actually do house calls. I love the low overhead. The patients love it. And sometimes 5, 6 people, it's almost like a Botox party. 5, 6 people show up at one time to be treated. And what fun it is. Uh, and low overhead, most of all. I'm going to get back into it. I had 3 practices in the past. I sold them and retired 2 or 3 times. And now I'm going to stick with it till I cross over by the grace of God. So that's what the vision is. So if you want to be treated by me, you can Zoom you, I can teach you. If you get a group, I can do that as well through Zoom. And so I can teach and treat, and it works beautifully. And I also do a technique called creation, which I have taught to some extent and will treat you with as well on the internet. And sometimes we have blockages to healing. We have to remove those blockages. And that's what this does too. It removes blockages. But that's a little more deeper technique, going through the 3 phase: acute, chronic, and degenerative or inflammatory. And we can find out what problem or what stage they're in by palpating with this very expensive golf tee to find the best point. All right, let's move on. Now, as I said, needles can be the strongest, but they also can be a little uncomfortable in the hands. Not a little, a lot. I've needled myself thousands of times, maybe tens of thousands, because of my recurring asthma pneumonia. Am I 100%? I'm 98%. Now I'm working on homeopathy and physician heal thyself thing. So I'm being trained by a famous homeopath, and I've never met him, but I'm with him all the time. The guy's amazing. I was with him last night till 11 o'clock last night on the phone. Okay, magnets are great for all kinds of pain, but the positive polarity tonifies, strengthens, builds up. And to get positive polarity, you can see this little dot or indentation here on the magnet. To tonify, that would be uh, away from the skin. To sedate, the little dot or dimple touches the skin. So when the dimple or dot touches the skin, that's a north pole, sedation, or negative pole. Positive, and sometimes you can use Korean hand therapy pellets if you so desire. I don't anymore because they're not, to me, they're not powerful enough. You in the gold would be positive polarity, and or the little indentation or dimple projecting out away from the skin. Okay, we'll go over that again later. But moxibustion is tremendously powerful. The ion beam I talked about, massage, acupressure. If all you do is acupressure and you just either tonify by going clockwise on the point or sedate by going counterclockwise on the point, it works as well. We all know massage is amazing. My massage therapists are amazing, the things that they can do. And they understand Chinese medicine. I've taught some Korean hand therapy or Korean hand energetics as well. And because sometimes they get a little tired and it's hard on the body, rubbing bodies all day. So if they can do a little less of that and still get the job done, it's a beautiful thing. Now, this area right here where he's probing or pushing on is between the 4th and the 5th metacarpal, and that's a point for sciatica. Right where you come to the indentation here, this is my drawing tool, which I'll be using in a minute. Right where you have that indentation, that meeting point, that bifurcation of the fourth and fifth metacarpal. Tremendous for sciatica. Okay, I just want you to lock a few of these things in. This is just the introduction. So this is how we would hold our probe. I have a very expensive silver looking probe, but you know what? You can use an Apple pencil. Let me get my picture over here so I can see myself. Oh, there I am. You can use a Apple pencil. You can use a golf tee. You could even, I've used an ink pen, but I try to retract the cartridge so I'm not drawing all over them. But in some cases, it's nice to have that. And I'm planning on inventing in something that it'll come out so we can mark the area. Now, the way I mark the area now, I just do a counterclockwise if I'm sedating or clockwise if I'm tonifying uh, on that area. So I see a little indentation so I know where I am. Now, if you have somebody that has very thin skin, they've been on prednisone for years or something, you do have to be a little cautious. And it's only happened one time, but I went all the way through the skin and I noticed, oops, my probe is gone because it was in his hand. So that's the only thing that I would recommend being careful with thin-skinned people. And if you get a golf tee, you might want to file it down a little bit so it's not so pointy as well, okay? Or sharp, that's a better term. Okay, now here's the moxicons. These are a lot of work. I used to use these. I don't do these anymore, but they're good. They work great, but they're a lot of work and a little risky in reference to burning people. Moxa stick I like better. This is kind of like a cigar moxa stick, and I like the charcoal the best because it's not quite so stinky. There's an ant on my screen. I'm not sure where that came from. I haven't seen an ant in years in here. But anyway, now these are the KHE pellets, KHT pellets, back to the moxa. I like the real thin. I wish I had one with me. It's behind me. I'll show you later, and where to buy those from. You can get them from AccuMarket or from Lhasa OMS. I'm relatively sure, or Amazon. Amazon has everything. There's nothing they don't have. We won't go into that. So these are the original Korean hand Korean hand therapy pellets. These are the originals. And they work. I used them for years, but when I moved up to a lot more expensive magnets, they're about 12 or 14 cents each. But the beauty of it is you can use them over and over and over again. These, use them once basically and you're done. But it is nice having the tape on it because with the Korean hand Entergetics, we haven't come up with a way to tape them in place automatically. We're close, but we're just not. So you just tear off 10 pieces of tape and put them right here or on a desk or somewhere, put them on your thenar eminence or wrist, and just peel them off one at a time. Now, my teacher, he takes the tape and actually places the magnet right here on the tape like this, and then he just takes his index finger and pulls the magnet off, and then it's right in place. Now, I do that sometimes, and sometimes I just take the magnet and place it because I place it myself, and then I just tear off the tape, or I might even take a dozen of them with the dot touching the skin. When you tape it in position, the dot touching the skin, as in a North Pole sedation, and then I have about 10 on the other side, especially if I'm treating myself, with the dot facing out. And I have them separated so I can just go back and forth and have whatever I need. Now, you can do it that way, or you can do it like Steven Steitler does and just take it and put 10 or 20 magnets on there and then peel it off with your thumb. It's, preference, personal preference. Now, you do have to be a little cautious if you're treating yourself and you go to treat others because the magnets are going to stick to you, as what's happening to me right now. And that's okay. If a technique isn't working as well as I feel it should, what I do is I'll add another magnet to it. Sorry about that. Just need to get up a little higher here. There you go. Okay. I will add a magnet to it. And I had a patient, a year and a half ago, and I was with a group of massage therapists in a massage therapy school, and I was doing demonstrations. The lady had a collapsed lung, and she had a frozen shoulder. She literally could not raise the arm, and she had stage 4 cancer. She's about 80-something, and a wonderful lady. And I uh, went to the lung area, found a good point, and treated it, and nothing really happened. So this was so cool. I took, that's great medical terminology, I know. I took another magnet and I just kind of dropped it. Watch this. You see that? It's pretty cool. And it went right in place. But I dropped it from up high, and it went whew, and stuck to it. And it was like her lungs opened up immediately. And the crowd, they, it was like I was like Dr. Tan for a minute. I thought I was Dr. Tan. Um, and the next thing I knew, she raised her arm over her head. And the crowd, all the massage therapists, they were like, wow. And I was wow myself. There's miracles that can be wrought with these techniques, and that is the truth. Now, all these needles is not that much fun. I talked about North Pole is negative. I talked about South Pole is positive. The South Pole is the. I know I'm saying this a lot, but this confused me for a long time. The South Pole is the little dimple. The little dimple, is that the dimple? See, I treated myself. I'm treating myself for my vision, and I always wear glasses. I'm not wearing glasses today. I don't need them, and I could even see the little dimple. And you can see the dimple. Remember, I said the dimple, the dot, the indentation touching your skin is North Pole, negative, sedation. Now, the South Pole is positive, and that would be the dimple, the dot, the indentation facing out. Okay, like this. See how it's facing? I've got 20 of them here. I wouldn't recommend using 20, although it would work. It might even work a little better. I have some magnets this long that are almost like a group of these together. And one of my teachers gave it to me, and I'm supposed to be using it on patients and let him know how it works, which I'm going to start doing tomorrow. All right, so that's the North and South Pole. Let's keep moving here. Now, you can use needles, and some practitioners like to use 70 needles. I feel that at most, as Dr. Tan feels, and Master Dong, and who are some of the other ones? Master Dong and some of his students that I've actually spent time with Master Dong's students from Taiwan. And they're not much older than me, some of them a few years older. And oh my gosh, their level, their knowledge. But it was funny. The last time I was visiting one in Chicago, um, he was so interested in the magnets. And I've got to send him a batch because he was very interested in it because he hadn't done that before. He'd done everything in acupuncture and five element and Master Dong and his level. It would take me 20 lifetimes to be at his level, but I do different things. I don't just do needles. I use magnets. I use auricular, or it's called a biphasic probe. Yeah, here it is. Here it is. This is not a camera. This is what's called a biphasic probe. It's the StimFlex 150. Good luck finding one of these, but it measures negative and positive polarity on the ear. Now, you can use this on the hand as well to measure negative and positive polarity. And if you look at this, you can see it's a probe inside of a probe. So it gravitates towards the best polarity. Now, I teach this as well, and webinars, and we've got a seminar coming up all day on the 12th, and there's no charge for it. And now, historically, this machine is huge. It's called the StimFlex 400 or 400A. It's big. I call it it looks like a four-hole Buick. It's a monster. It's old technology. There's a German machine out there, and I had it. I gave it away, and it's good. And I wish I had it back, actually. So called a Point of Select, and it comes from Germany, and maybe via China. I'm not sure. And it's good too, but it's so techy. You know, starting a BMW, you have to hop on one foot, turn the key, push 14 buttons, and hope it doesn't blow up. I shouldn't have said that. I love BMWs, but I'm more of a Lexus guy myself. I have a 21-year-old Lexus, and it runs better than the day I bought it. And the Lexus mechanics say the old ones are better than the new ones, so I've just run it forever. Just broken in at 198,000. That's my house call car. But you can use this as well in Korean hand energetics. I have done it before, and I probably will start again after just showing it to you today. So you can use needles, but it's not the most comfortable thing I've ever experienced in my lifetime. Now, of course, yin and yang principles. Yin is silver, or is North Pole. Yang is South Pole. Positive, negative, female, male. Most of you know that. Up and down, passive or active. So we do want to look at, just as in traditional Chinese medicine, yin and yang, excess and deficient, internal and external, hot and cold. You want to look at those 8 principles to come up with a differential diagnosis in Chinese medicine. You want to look in the ear for veins and all that. You want to look around the face, even look on the hand for scar tissue, for scars in general. Many times, healing can't occur because a scar, an injury to a hand or a surgery or something, has cut off a meridian to some extent. Now, I believe that the body reroutes those meridians. I even believe people who have implants for teeth, that acupuncture still works. The Germans think that it blocks it, but I've had patients that have had all implants in their mouth, and the acupuncture still works. Maybe it blocks it, doesn't make it allow it to work as well, but it still works. Now, we talked about, okay, now we're going to have more fun. We're going to talk a little bit about correspondence therapy. And let me move my picture out of the way. Every part of the body has a correspondence, and my cat is here, so I'm going to have to pet him a minute, or reflex points on the hands. Disease, pain, and tension are reflected. Let me say it again. Disease, pain, and tension are reflected in the hands as tender points. Your patient will tell you when you find the right point, because they'll jump. It'll hurt. And I mean, we don't want to cause a lot of pain, but we want to find the best point. So sometimes when I'm looking for a good point, I have a good idea where it is, because it is a range. In Chinese medicine, I know stomach 36 is 3 soon below the inferior kneecap or whatever, or the patella. And it's very precise. But in reality, as I spent time with the masters, Dr. Tan, Master Dong's students, who went through his program in Taiwan, find the best point. We have a range. And the anesthesiologists that do this work, it's a range. So you have to search for the best point, okay? And then when we find the point, sometimes it's not a bad idea to rock back and forth, side to side, and make sure you're on the best point with the golf tee. Now, if you're using needles, I just create a little indentation. I got this from one of the masters in Chicago, who was trained by Master Dong, T-U-N-G, Master Dong. I guess that's how it's pronounced. Anyway, and he would find the point and create a little indentation and opening, and it's beautiful, because some of these hand points are uncomfortable in Master Dong, Richard Tan, or any of it. And if you do this, take the time to open up the acupuncture point and then needle, it's much less painful. Now, you do it with this too, in Korean hand energetics, and you find the best point and you mark it by pushing in a clockwise or counterclockwise mode. Now, when we're looking for the best point, we might go above a little bit, below a little bit, to the side, until we find that point that makes you jump. Kind of like finding a Dr. Tan point. He would palpate with his fingers. Oh, very good, Ashi. Ashur point. Good Ashur point. I think it's really Ashi, but they have an issue with their R's. So, good Ashur point. I love that guy. Amazing, amazing. Okay. And I honor him and give him great respect. He changed my life. When I first saw him in Fort Lauderdale 20 years ago, and I was retired with horrible respiratory issues, and he lined up 15 patients in a row. Some of them had 20 surgeries. They were crippled and couldn't raise their arms or legs. They had asthma. Went from one to the next. He knocked out about 3 people too. They had needle shock. And of course he would say, and I always remember this, very good treatment. Very powerful treatment, but we would lower them down so they wouldn't get a skull fracture or something. Okay. And as far as I know, nobody did. So we're looking for these tender points. So important to do so. And correspondence therapy requires precise targeting of the specific areas in the hand. Okay. Now, as I said, it is a microcosm or a homunculus. So it's a microcosm of the entire body. The entire body is located on the hand. Any part of the body can be treated using Korean hand energetics, Korean hand therapy, or hand therapy. I want to give credit to all. Dan Lobosh, Steven Steitler, Nader Solomon, Brian Franks. All these guys are great. Some of them are Oriental medical doctors, and some are acupuncturists, and some are just medical doctors and anesthesiologists who took training in acupuncture. But they do more of the German style. And although they do some French too, because they look at the phases. Even, I want to really give you some good information, those of you who are acupuncturists. The point is not the point. They move, they migrate with degeneration, with inflammation. That's the reason you got to find the best point. It's the reason Dr. Tan got 25 new patients a week, and he released 25 new patients a week. People knew they were going to go in, and they're not going to just wake up an hour later saying, "Oh, I'm very relaxed." No, they were better. They had their frozen shoulders better. The sciatica was gone. Now, might he have to treat them a multiplicity of times? Yes, depending on the severity. In China, they treat every day, maybe twice a day. And I know Master Dong used to, when he was treating a diplomat, or not, the president of Vietnam or something, he treated him every day. He had a horrible stroke. And he treated him every day, I think twice a day. So the beauty of this technique is treat every day, twice a day if you want to, 3 times a day if you want to, because it's like getting an extra treatment. And so that's the reason it's so important to learn this technique and to use it and to teach your patients how to treat themselves. You're not going to lose patients. You're going to get tons of referrals because it's all about giving and sharing information. We don't have to hide information. No, we need to share it. And that's what Dr. Tan did. And he was under a lot of scrutiny because he would teach anybody that showed up. He didn't care. I was a chiropractor at the time. I wasn't even I was licensed to practice acupuncture under my chiropractic license, which was about 150 hours. And the training was good, especially using the low points and yuan points and sedation and tonification using electric stim, microcurrent. And it was good, but it just wasn't enough for me. I wanted more. And when I saw Dr. Tan, that's when the lights came on. So the beauty of this technique is you can place any technique out there, any TCM technique, any front move back shoe, any extraordinary vessels, which is coming up, another seminar. You can put it all in the hands, and it still works. I've even taken Master Dong's points and applied it to the hand using the bipoints and the tripoints. It's just more difficult with these very powerful magnets. You have to use the Sujak magnets in that case, because otherwise they'll stick together. Or you just have to go to the other hand to finish. Okay, if they have a left lower extremity problem, and you've taken them so far and they're better, but you want to take them further, then you can go to the thumb on the other side, and that would treat the lower extremity, the sciatica, or whatever the issue is. Okay, let's move on. Now, this is a nice representation of the body, and of course, this area right here would be the facial region here. Okay, and the eyes, the nose, the mouth. You can see it here. You know what? I'm gonna get my drawing device out. I love this old Sony computer. It's a little outdated, but it works. And let me go ahead and draw some things for you. Okay, you can see where this would be the eyes, and since this is the left hand, let me get rid of that. Let me back that out. Okay, since this is the left hand, if you had a left eye problem, try not to poke myself in the eye. Left eye, that's where you would look on the hand. Now, if they had sinus, this is where you would look on the hand. Okay, and I've even used this for people with speech problems, this area right in here. Okay, and I have them talk. I have them open and close their eyes. And right now, this is the first time I've taught without glasses, and I don't need them. I'm treating myself right now in the eye protocol, and I'm tonifying, and it's got me a little excited. You can tell. And because I'm tonifying myself, okay? Tonifying my eyes. And I've got a kidney point in as well. Kidney, eyes. Yeah, well, also liver, eyes. I've got liver points in for eyes. Kidney, maybe not eyes so much. Kidney, more hearing. And by the way, I treated a 97-year-old a couple of days ago, and she had hearing aids in. And I've treated her for years. She couldn't hear me, just fitted for these new, very expensive hearing aids. And so I had to yell, take that thing out. And then I did a protocol on her, and she was repeating verbiage after me within 5 minutes. And I've had other patients that were completely deaf in ears, and the hearing came back 100% in the 50% ear and 50% in the dead ear. They said would never come back. And I want to share all that with you guys. We can do it all through Zoom. And some of it is with needles. And I even treat acupuncturists and doctors on Zoom, and I have them needle themselves. I've treated many needling themselves with sciatica, and in about 2 minutes, the pain is gone, and the sciatica is gone. But for the general public, this is better. And this is probably better anyway because the magnets stay on and because you can treat yourself over and over again. That's the beauty of it all. Now, we're looking at this picture again. So this would be the heart area right here, okay? And you could look at this as the lungs in here, okay? Although this would be the lung right here. This is the lung 1, which is the front mu point. This is also lung 1 here. Remember, I said this is the left hand, so this would be the left side, left lung. This would be the right lung here. Okay. Now, a great area. This is the throat. If they have a sore throat, amazing area right here. But since this is the lung meridian right here, in Chinese medicine, we use, or in Richard Tan's technique, from the I Ching, I-C-H-I-N-G, we use a point called lung 10, which would be approximately right here. And it's tremendous for sore throat. Now, do I bloodlet lung 10 on the thenar eminence? Yes. And then large intestine 1 and lung 11, sometimes I do. But you could sedate lung 10, where I have my little cross right here, and that would calm down the sore throat. Amazing. You might have to use 2 magnets in some cases, depending on the severity of the sore throat. Of course, you want to make sure they don't have strep. We don't want anybody to get subacute bacterial endocarditis or anything like that. So let me erase this. Oh, there it is. Here we go. Sometimes I leave my markings on there and I can't get it off, so I thought it better if I get rid of it now. Okay, now let's move forward. Okay, now these are the basic palmar areas, and this area right here would be C1, or on the anterior neck, because this is the palmar area, the front of the hand. Okay, so this would be C7 right here. This would be T7, but in the front area. Now, halfway between the Ren 1, which would be here. I like drawing. I like my little drawing tool. Halfway between that and Ren 14 here would be the front mu point. I'm sorry. Ren 8 is here. Here's Ren 8. Oh, I love drawing. Sorry if you can't read it. I'm having to lean forward. Okay, There's Ren 14 right here, and here's Ren 8. This is the umbilicus right here. Umbilicus, navel. Halfway in between is Ren 12. Okay, now it's front moot point of the stomach. It's a tremendous area to treat for reflux or gastroesophageal reflux disease or or hiatal hernia, however you want to put it. Now, I also have a technique of bloodless surgery, chiropractors called it in the old days, where we pull down the esophagus and straighten it. Many times you have reflux from a crooked esophagus. So what we do is we pull down from under the xiphoid process after they hold it, taking a deep breath. The Dr. Baruti, chiropractor from Waynesville, North Carolina, wrote a book on this. And you could probably get it on Amazon. Dr. Baruti, brilliant. Under the xiphoid, and you're pulling down, pushing. You can even take like an egg, not a real egg, like a ceramic egg, which he says in his book, and you're pushing down just to the left of the midline or of the Ren meridian, and then coming off to, when you get down to the navel, pulling off to the left a little bit. And that can help straighten the esophagus, and I've used it many times, taught my patients how to treat themselves and their family members with it, and it works beautifully. Works amazingly well.